Okay.
So during the second trimester, the fatigue starts to diminish.
Can you also give us some other things that we need to do to ensure that the baby comes out very healthy?
So one, you always have to.
Welcome, ladies and gentlemen, to the Bed and Beyond podcast. Today, we're going to learn about the second trimester, which is from 4 months to 6 months. And we're going to look at what happens to the mother, the baby, and most importantly, we're going to look at what you need to do as a pregnant woman. So you want to stick around to the end. Let's get started. All right, Portia. So talking about the second trimester, what are the changes? Let's start with the changes that occur in the pregnant woman.
Yeah. Okay, there are lots of changes that happen, but usually we like to talk about those ones that are very common to most women.
Okay.
So during the second trimester, the fatigue starts to diminish, like it starts to wear off, and just because now the body is becoming adjusted to the new fetus, it has accepted that there is somebody in the house now, so I just have to
they have to
accommodate the person. So the women, most of them start becoming energized, like they gain back their normal strength as they used to have.
Okay.
So they're able to work around, go to work, do their normal chores at home, do a couple of things that they were not able to do in the first trimester.
Okay.
And because most people are able to work, they overwork themselves and they end up getting some pains, especially in the joint. And this joint pain is sometimes also due to the progesterone and the hormones, like the estrogen, everything going up in the woman's body. Also, some of them begins to feel pain in the knee and in the legs and at the back of the knee. This is as a result of the growing fetus. The moment it's becoming big, it puts pressure on the leg and the foot. Let's say the whole legs coming down. So some people feel those pain too. And one peculiar thing that you can't hide, you can never hide. Other people call it cloasma, others call it hyperpigmentation. That is the changes that happens to the skin. You look at the face of a woman who is pregnant and you don't need somebody to tell you. It looks a big dark or
some even have acne and
so
that's a hyperpigmentation.
Yeah, that is as a result of the melanin in the body becoming like the body is producing a lot of melanin. That is when you see all those cloasma. Some people call it cloasma, others speak of hyperpigmentation.
I see.
So it makes the body change. And some people lose their hair during this stage.
Interesting.
Yeah, they lose their hair. Their hair start to fall off. And others, somebody like me, fortunately, you tend to grow more hair. So the last time I was telling people, if you want to get more hair, keep giving birth consistently.
Is it scientifically true? I'm not sure.
Because I can attest to it. Before pregnancy, I had long hair, but it wasn't that long. It wasn't that thick. It wasn't that heavy. But after my first childbirth, I realized, my hair is becoming...
Is it not because the man has transferred some hair?
No, please. Don't start giving the credit to men. Not again. Not today. So after like 2 births, I realized my hair is now full, very thick, very long, and people are like, how? So I'm just trying to tell you, if you think, but you have to try it first. Give birth to first one and see if you're not going to lose the hair.
Because before you end up like...
Because if you're going to lose the hair, then you turn up, if you're giving birth consistently, you're going to get bald.
So what else happens again?
Then people start to get digestive problems, something like reflux, heartburns. This is as a result of the fetus ingrowing. What happens is, because it's growing bigger, it tends to compress or push the stomach a bit. So imagine this is the stomach and this is the baby pushing it. When you eat, you get some reflux, some get heartburns. And with the heartburns, I just want us to give people some small remedy. Others taking yogurt. Some dairy products and some ice cream, and the heartburn diminishes. So you have to
find what works for you.
What works for you. Because myself, I used to take in an ice cream.
Oh.
So I know when I eat rice and stew, I'll get the heartburn.
And then you have ice
so
cream.
I get my ice cream just behind.
I see.
Yeah.
That was like enjoyment for you. I mean, so each time you take rice, okay.
So after taking the rice, I'm just taking my ice cream,
and then that's
to prevent any
suppress.
heartburn.
Okay.
Yeah, that is one thing people can also do just to like prevent all those things. And one thing that is also common in the second trimester is swelling foot.
Okay.
Yeah, you see people feet become so big.
Yeah,
very yeah. There is a lot of changes that goes in them.
What causes that?
That is as a result of fluid retention.
Okay, is it that when they drink water, it goes to their legs?
No, oh dear.
No,
because you know, I told you the last time, the first trimester, that there is more blood supply to the kidneys.
Yeah,
giving it more job to do.
Okay.
So, yeah, so the body is overworking itself. And one thing I realized is when you're pregnant, most of them during the second time, when they sit down, it's even very difficult for them to stand.
Okay.
They feel lazy. Immediately they set up to even talk or chat or do something. So with the swollen foot, what I think and what I've been suggesting to people is you always make sure you elevate your foot.
Okay.
When you're sitting down for long.
To put your foot
yeah,
on.
And when you're sleeping too, you elevate your foot.
Okay. I see. Good stuff.
Yeah, so you don't get that retention in the foot or swelling on the foot. Yeah.
Okay. So now that we know what changes we observe with the mother, let's talk about what happens to the baby. Because I know at this point the baby would have crossed from the first trimester onto the second trimester.
Yeah. During this stage, the baby tends to grow bigger. Yeah. And more features are being seen.
Okay.
Especially the hair is being seen. Like the hair starts to grow at this stage.
Okay.
The eyelashes and the eyebrows all start to grow. So all hairs in the body part start to grow and becomes very visible when you get a good scan taken for the baby. And this is the stage you also feel the baby's movement. Some even go to the extent of saying the baby is running in the tummy.
Okay.
The baby is kicking.
Yeah.
You could feel the baby's movement in your womb. Some can even move to the extent of even entangling their body with the umbilical cord.
Interesting.
Yeah. That is when the
so there's a lot more activities.
Yeah, because there is more room in there. They are not that big to the extent they can't turn. They've got more room because during the third trimester they are big, the placenta, everything has developed, and they find it difficult to turn.
Okay, so by the second trimester is
they can do whatever they want in there.
Okay,
and also that is when their senses also start to develop.
Okay,
so you can speak to the baby. I always say this. You don't have to wait for the baby to come out before you start talking to the baby.
Okay.
The men watch and please. You can start speaking to your baby now.
Okay.
From the second trimester. Because you realize even some of the babies, they are very sensitive to the extent that when they are in a dark place, you switch a light on, they move.
Okay.
Some of them are in the tummy, but when they hear the sound of maybe a peculiar person that speaks to them every day, the person speaks and they move.
Okay.
So the senses start to work at this time. So whatever you want to tell your baby, everything you want to communicate, you can tell the baby, and the baby is going to hear it.
I see. Awesome.
Yeah.
Nice stuff. At the end of the day, we are all looking for a healthy baby.
Yeah.
So what are some of the steps that both the mother and the father need to take? I know you've mentioned a number of them, but can you also give us some other things that we need to do to ensure that the baby comes out very healthy?
Okay. One more thing that I haven't added is during this second trimester, that is when that pinkish skin starts to form. Because that is when the veins, the capillaries under the skin start to form. So you see a very good blood supply coming under the skin because the veins are now formed. So you give them that pinkish and beautiful skin.
Okay, nice.
And during this stage, all I can tell mothers is because you are active, you try to do things you love, things you really like. And with the men, you just assist them. some of them, because they're energetic, they can do most of the things, which at the end of the day can be very stressful. So you as a husband, you always have to be cautious, monitoring your wife. What is she doing at this particular time? What can I do to help? Although they might feel like I'm now back, I'm now very strong, I want to do everything. You have to keep an eye on them, because they will feel like they can do everything. But no, there are certain things they don't have to overdo. So one, you always have to drink very well.
Drink a lot more fluids.
To stay hydrated. Because you need that to help, like, put forth a very bouncing baby girl or baby boy. We all know water is life. And you need to eat healthy. This is the time you need to eat more fruit, since the skin is forming. Eating more carrots, because we all know carrots gives like a bright and a nice skin. So you need to eat very well at this stage, so that all the development that is coming up could come up very beautiful, not in a bad way or something. And also, you can do your exercises, but as I've said, you shouldn't overdo anything.
No rigorous. It should be the normal. Just
it should be a normal. And we've talked about rest. You need to
rest.
Rest when there is need, because it will get to a certain point you wouldn't even feel like sleeping. So when the time is due, you feel like sleeping, you should try. And give yourself that sleep. And this is the time you also have to start preparing for the baby.
Preparing like how?
You have to start preparing for everything, like where you want to give birth, the things you will need. You start them. Now you don't wait till the 3rd trimester.
Because you might not have the energy. That's understandable.
You need to start preparing at this stage, and this is what will help you very much, and also help the baby. You also have to monitor the symptoms. Let's say if you are experiencing any severe pain, severe lower abdominal pain, severe headache, anything that is beyond the normal mark, you just have to report it.
Report it to the hospital.
Don't keep it to yourself. No. Monitor the way you eat, everything. Your blood pressure. When you go, you make sure you check. When you home, if you have the cough and everything, you can also check it home. You write it. If there is any deviation from normal, you just quit it.
Obviously, these are things that you need to monitor, so that at the end of the day, if you are seeing something different, you can quickly get medical attention. That's great. Great.
And this is when the men also, you come in to help, and also make sure you are giving that emotional support to the child, the baby, and the mother. You don't wait till the baby is born. Give them that support. Speak to your baby in the womb, so that by the time they come, they are already familiar with the voice. They know who is speaking when they come out, and this helps build the bond between the family. If you have kids in the house, you have maybe other children, they are also permitted to speak to the baby. It's not related to just the dad. All the children in the house can also speak to the baby whilst the baby in the womb. Let the baby know they're expecting him or her. And it's a nice feeling when we all come together to help.
Beautiful. So if you haven't watched our other videos, yes, I'm going to leave it on the screen here. Please make sure you do check them out. Thank you very much, Portia. Thank you.
Thank you. And thanks to all viewers.
All right.
It's much appreciated. We still need your comment. And if you're in your 2nd trimester, experiencing anything you think you want us to know, you can just pop it down there and we'll have a look at it, chat on it, give you some knowledge about it. And if there is a need to go to the hospital, we will let you know.
All right. Cool.
But all that you have to always know is that when you're feeling anything different from normal, you should see your midwife or your doctor. Thank you.
Beautiful. All right, viewers, we might have to end here. We are so grateful that you made it to the end. If you did, please comment below. And if you haven't yet subscribed, please make sure you hit on the subscribe button